Dear friends, today we are going to see NT scan. NT scan is a nuchal translucency scan. Nuchal translucency scan is a predictive test for Down syndrome, that is trisomy 21. Down syndrome or trisomy 21 is a congenital chromosomal anomaly which is seen in fetus. Now, when NT scan should be done? Prior to that, I want to say NT scan is only a predictive test for Down syndrome, not a confirmatory test, but along with other tests it has got significance. When NT scan should be done? Ideally, the NT scan should be done in first trimester of pregnancy at any time between 11 week 2 days to 13 week 6 days time span of gestational age of fetus. Now, things involved in NT scan. NT scan involves crown to rump length measurement, visualization of nasal bone along with its mucosa, visualization of nuchal fold, measurement of nuchal fold thickness. While measuring nuchal fold thickness, the fetus should be in supine position in the uterus, and the section is taken in such a way that the entire screen of your ultrasound machine is occupied by fetal head and upper thorax, and proper section is taken, and then calipers are placed and nuchal fold thickness is measured. A properly measured nuchal fold thickness, if it is more than 3.5 mm and nasal bone is absent, then this is a soft marker for aneuploidy 21, that is Down syndrome or trisomy 21. In that case, the lady is advised double marker test, that is a blood test. If this is also positive in favor of Down syndrome, then chorionic villus sampling biopsy is advised. If this is also positive in favor of Down syndrome, then amniocentesis is suggested. If this is also positive in favor of Down syndrome, then blood test known as NIPT is suggested. If all these tests are positive in favor of Down syndrome, then there is a high chance of fetus having Down syndrome or trisomy 21. But in spite of all these positive tests, there are chances that fetus can be completely normal. Now, other things which should be done along with NT scan are: overall morphology of the fetus should be examined. All 4 limbs of the fetus along with their joints are examined. Fetal heart is evaluated for tricuspid regurgitation. Fetal head is seen specially for diencephalon. Other congenital anomalies like anencephaly, skeletal dysplasia, diaphragmatic hernia, these all also should be ruled out while doing NT scan. Now, ductus venosus Doppler and uterine artery Doppler can be accompanied with NT scan. As you know, ductus venosus is a direct communication between umbilical vein to inferior vena cava. This ductus venosus carries oxygenated blood directly from umbilical vein to fetal heart by bypassing it from the liver. This ductus venosus closes in first week of neonatal life of the fetus. In full-term babies, in preterm babies it might take little more time. The ductus venosus Doppler shows triphasic waveform. In this triphasic waveform, there is S wave, D wave and A wave. The S wave is the highest peak that suggests ventricular systole. D wave is the second peak that suggests early ventricular diastole, and A wave is the third peak that shows atrial contraction, that suggests atrial systole. If absence of A wave is seen, then this suggests chances of placental insufficiency to the fetus. If increased nuchal fold thickness seen along with reversal of A wave, then this is highly suggestive of fetus having cardiac anomaly or Down syndrome like trisomy 21, or the Down syndrome trisomy 21 or trisomy 13, that is Patau syndrome, or trisomy 18, that is Edwards syndrome. Now, uterine artery Doppler also can be accompanied with NT scan. Uterine artery Doppler involves measurement of resistance to the blood flow in uterine arteries. A mean PI value, that is 1.84 plus or minus 0.55 in first trimester of pregnancy is suggestive of high PI. That means there are chances of heavy bleeding during pregnancy and complications like preeclampsia. To avoid these hemodynamic complications and complications of preeclampsia, the lady should be given blood thinners like aspirin from 3rd month onwards by the gynecologist. So we'll stop with this. Thank you. Jai Hind.